Hello, everybody. Good afternoon. And today I am here to give a small, very brief talk on the role of acupuncture in treating low back pain. And since it's a very uh, general talk today, so we'll just talk about a few causes of low back pain. Then I'll speak about a few causes that I usually see in my clinic, Western causes that I see in my clinic, and we treat on a daily basis, mornings and evenings. And then we'll come on to what all modalities of treatment we use in our clinic. See, because you have to understand, at my setup, at my acupuncture setup, I usually get patients with chronic low back pain, right? Acute patients usually I do not get at my setup. So for these chronic pains, you sometimes you need multiple sort of instruments for the patient to get pain relief and for him to start healing, right? So we'll start with the main causes of low back pain. So causes of low back pain are multifold. They can start from something like a injury. So the injury could be a sports injury, the injury could be a fall, right? The injury could be something related to your everyday posture, right? Say long time standing, or long time sitting in a particular posture, lifting weights in a odd way, so it is like a gym injury, right? Then from injuries we come to muscle spasms, right? So again, the main causes of muscle spasms being odd posture, right? So maybe sitting on a sofa, which is where the surface of the sofa is not hard enough. So because of that, you tend to go inside the sofa. So that doesn't give you enough support to your spine. So that could cause muscle spasms. Then you could have issues like autoimmune conditions like ankylosing, and rare conditions like rheumatoid, right? You could have some anchor positive spondyloarthropathies, right? So you can have multiple reasons for low back pain. Then coming to issues like disc prolapse, right? As in layman terms, we call it sciatica or pain, which is radiating from the back and going to the leg. Other could be issues with bone. So bone issues being something called as facet arthropathy. Facet is a joint that connects the two vertebrae, right, in our spine. So that facet joint could have a joint arthritis, right? That could be one reason. Next, we could have something called as a piriformis syndrome, right? Piriformis is basically a muscle that runs in our hips, in the gluteal area of the hips, and through that muscle, the sciatic nerve passes. So we could have the sciatic nerve being compressed if this piriformis muscle goes into spasm. So again, you could have symptoms which mimic sciatica, and symptoms going into the leg. Then we could have low back pain due to reasons like osteoporosis, right? So wherein the bones, the spine gets weak. It's a weak spine. There is less amount of calcium deposits. Vitamin D is less, right? So from osteopenia to osteoporosis. So that could be one cause of low back pain, right? What else? Low back pain. I think yes. So in my setup, usually on a daily basis, yes. One more reason, one more cause, or one more type of patients that I see commonly in my setup is low back pain due to lumbar canal stenosis. So here, what happens is that the lumbar canal is basically the size of the lumbar canal is significantly reduced, as a result of which not enough blood flow is going from the back to the legs. So the patient comes with feeling weak in both the legs, or patient comes with symptoms of feeling lethargy in both the legs, right? So cannot walk. There is a limited distance which the patient can walk. So yes, so out of these, as I told you in my setup, lumbar canal stenosis is one kind of disease which, or one kind of condition that I see very commonly in my setup. Along with that, disc prolapse, as I said, sciatica patients, facet arthropathy. So these three conditions, are the most common ones, and obviously, autoimmune conditions, but rare, because since in terms of number also they are very rare. So yes, so I think this finishes our causes. Just to generalize what causes low back pain, so that we have an idea. So since I myself I am a postgraduate in anesthesia, then I did my specialization in pain management, right? So because of that, I know my western aspect of pains and all very well. So what I do in my practice is I try to diagnose a pain using my entire knowledge. So that knowledge could be western, could be eastern, right? And then I try and combine those, the two sort of knowledges that I have, and then I come to a plan of action. What should be the best plan of action going ahead in terms of treatment. Okay, so now we come on to the next part of our presentation, which would focus on uh, what all therapies do we use at our clinic for managing pain, right? So most of you would think that acupuncture, since it's an acupuncture clinic, acupuncture would be the only acupuncture would be the only therapy that we are using at our setup. But that is not the thing, because as I told you, for chronic conditions we need to use a lot of, or we need to combine. So you can say it is integrative medicine, right? So we need to integrate a lot of therapies. Okay, so we start with something called as a Accuging health assessment system. So yeah, as you can see the video, so as as you see, we select the patient, then we give the patient a probe, and we measure the electrical difference between the source points of all acupuncture channels, all the 12 acupuncture channels, and we have the energy graph which comes on the screen. So you will just be, so this we are trying to touch all the source points of all the energy channels using a electrical conduction difference, and the energies you will be seeing on the screen. Okay, so here you can see, there are the channels are usually, as everybody knows, the channels are usually present on both the sides, right and left. So you get a value for the right side, you get the value for the left side. So the source points initially, as you saw, they are on the hands and also now on the foot. So we used all the source points for all the channels. So this particular energy graph, as this gives us an idea as to which particular channel, which particular acupuncture channel or meridian, there is less energy, there is more energy, or which channel is already balanced, which is imbalanced, right? So because whenever we treat using acupuncture, right, the focus is always on holistic treatment, right? You need to see, so you can see now how the graph comes for all the different channels. So there is a normal value, you can have value which is above it, which is excess, or you can have it below it, which is deficient. So as I was talking, whenever we treat with acupuncture, it has to be a very holistic approach. So for the holistic approach, you do not, you don't just see, okay, the pain is here in this area, in this particular channel, so treat that channel. You need to treat holistically. So this particular graph, not only helps you to sort of helps you with diagnosis, because you might not be treating a particular channel which actually needs to be treated holistically. So this helps you. It is like, you have a back pain, and based on the patient's history, say you have sciatica, patient comes with sciatica, and the patient tells you, okay, the pain is here, and you examine so and so, and you say, okay, I feel probably it is the L4 L5 or L5S1 nerve root, L5S1 nerve root, which is causing the issue. But for confirming, you usually say, okay, let's get a X-ray, let's get a MRI. So sort of a confirmatory test is the accuging, right? Plus the accuging also helps us to follow up. So using the accuging test, we can follow up how the when we treat a patient, how the energy channels are doing, in the follow up accuging test. Okay, coming to the next treatment, which is called peripheral nerve stimulation therapy. So, peripheral nerve stimulation therapy is was developed by a Japanese neurosurgeon, Dr. Nagata, right? And I went and learned this particular technique of PNST from him. And as of now, he stopped doing his neurosurgery practice. He had some issues with neck pain and all, which couldn't be resolved with even a surgery. So, but acupuncture helped him resolve the issue. So he went ahead and he stopped his surgery practice. Then he went and learned acupuncture. So now he practices acupuncture, and he developed this PNST technique, by himself and with his knowledge of neuroanatomy and dermatomes. So this particular technique usually works on dermatomes, right? It helps very well in pain relief. So basically, as you can see, we basically cause peripheral nerve stimulation, and using peripheral nerve stimulation, the signals are then sent centrally, and then this activates further the different pain pathways that we have in our body. So, what I usually do with PNST, Dr. Nagata usually currently his plan is he usually uses just PNST for patients, but here in my setup, as I told you, acupuncture remains the primary modality of treatment, right? So we add PNST as a additional treatment in addition to using acupuncture. So it is a add-on therapy, and it improves the results that we receive by using just acupuncture. Okay. Coming to this is a patient whom I am shown, in which I am doing needling. This patient is come to me for low back pain, basically back pain which is radiating to the left leg. It come with now the radiation has reduced significantly. Uh, so it all depends, how old or how chronic is your low back pain, right? What is the area of your back pain, right? Is it just going, along the back of the leg, also along the side of the leg? Is it also along the front of the leg? What is the frequency of the pain? What increases pain? What decreases pain? So all these things we use before we, make a protocol of acupuncture points that we can use for treating this particular patient. Currently, as you can see, I am using needles, which I am treating. Most of the people won't know, but so we usually use something called as a urinary bladder channel. So I'm using the urinary bladder channel for treating this patient's pain. Okay. Along with that, I'm also using something called as a Huoto channel, which is very close to the spine. Yes. So what is important is you have to be, you have to have your expertise in needling, you know otherwise it can cause complications. So you have to have your expertise in needling. You have to be, you have to do your course properly, and you have to have your knowledge. You have to have a sound knowledge of anatomy. All that is very, very, very important, right? Yeah. So this, if you can see this, I am trying to needle the. This is the gallbladder channel. I am trying to needle, and along with that, I am okay. I am also needling the his leg. As you can see, the area where the pain is radiating. I have also previously already needled his hand. I think I couldn't show that in this video. And yeah, so these are all pre-sterilized, one-time use disposable needles that we use at the clinic. And the sessions usually last for half an hour. Each session lasts for half an hour. And yeah, if there's any other therapy which we need to add for this patient, then we add. Yeah. Okay. So as I was talking in my previous video, if you do need to add some therapy, so for this particular patient, I added something called as body needles, right? So these body needles, again, they work on the process. They're small, very fine, small micro needles with a very good adhesive tape, attached to them, and we usually use them at acupuncture points. Also, we use them at areas called as 0 points. So, 0 points are these points which are located between the spinous processes of the lumbar vertebra, right? Based on what level the disc is, where is the level of pain, what is the level of pain. Accordingly, we apply these small micro needles, and these micro needles are very, very safe. You know, they usually try and give you a 24-hour effect, since acupuncture session is only half an hour duration. For say very acute pains, we use these needles. Or if say somebody is getting treatment but they have to travel, they are not with me for treatment, so the sessions that we are missing, we try and sort of maintain the effect of treatment by using these body needles. And they are very, very safe, very small size needles, and no particular precautions that you need to take with these needles. There is no issue of any allergy, no other problems with these needles. Very, very effective, and I think we get them from Japan, from Japan directly. Yeah. Okay, so this is something called as a electrostimulation machine, and the technique is called as electroacupuncture. So here what we do is we connect. I think we have a video. Yeah, I'll just show. So this is a machine. As you can see, there are electrodes, there are probes which with which I can change the frequency, with which I can change the intensity. So as you can see, I have connected. There is a red wire and there is a black wire. So there is a conductance channel which is formed between the two, and I connect the two. So as you can see, there is stimulation, there is movement of the needles which is happening. This is called electroacupuncture. We use them at a particular frequency, right, which suits the patient. So they have seen that when electroacupuncture is applied at particular frequencies, it has specific effects. Say at a particular frequency, if applied, it causes release of endorphins and enkephalins in the body, right? But if you use it at a slightly higher frequency, then it says that there is release of dynorphins. Endorphins and enkephalins are not released. So we make use of that knowledge which is available with us and add electroacupuncture. Now, the use of electroacupuncture, again, as I said, books say something, our practical knowledge says something, but at our setup, we use both what book says as well as what our practical knowledge says in terms of you using electrostimulation. Yeah. Okay, then another modality available at our setup called roll moxa. Okay, this is a herb which is called moxa herb. Locally, it is grown in China. It comes from China, not available in India. So we use specific acupuncture points, right? Wherein, as you can see, the roll moxa herb is usually present in the form of a small conical cylinder, and it is the herb is burned. So this is heat, as you can see, this is red. So we hold it over a particular point, and you have to see, the important thing is that the two hands or the two fingers, they are kept, and between that we have the stimulation, we have the moxa, so that usually there is no burning or something. So when you are doing the particular therapy, you have to do it in a proper technique. The technique has to be proper. So how roll moxa helps is basically, it causes heat. It provides heat which is at very high temperature, right? So it causes vasodilation. So locally there is vasodilation. That vasodilation means extra blood which comes in. This blood tends to bring along with it healing factors. So it heals. Secondly, it also causes tissues to relax. So it causes muscle relaxation, right? So these are the two beneficial effects of using roll moxa. Okay, again, this is another technique that we use. It's called rice moxa. It's I think nowadays it's used more in in Japanese form of acupuncture. Chinese also used, but for Japanese form of acupuncture, it's not actually rice. It's basically the moxa herb only. It's in the form of wool, in the wool form, but the size of the moxa is like a small grain of rice. So that is why we call it rice moxa. So this rice moxa, it provides even more intense heat compared to the roll moxa, right? So but again, as you can see, this covers a very small area. If you compare it to a roll moxa, it covers a very small area, and benefits are equivalent to the benefits of roll moxa. And yes, this is one technique that we use at our setup. Okay. Coming to another therapy that we use at our setup, this is Japanese. Manaka is a Japanese this thing, therapy, with used in conjugation with acupuncture. So basically, you can see this is a small bamboo cup. This small bamboo cup is open from both sides, and what we have done is we have filled moxa wool inside this particular bamboo cup, right? And then the moxa wool is burned. So this the you can see the moxa, the bamboo cup, that it gets hot. So why we use this therapy is because, as you can see, it covers a very big area. So sometimes, when you have low back pain, it is usually, say, not a point, not localized, it is an entire area. So how do you cover an entire area when you are using roll moxa? Then you have to cover a lot of points. So you can, when you use bamboo moxa, you can cover a lot of areas. And when we use the bamboo moxa, along with that we use a metronome. So the metronome has a frequency for each of the different acupuncture channels, right? So suppose I told you we use, at the time of needling, I told you we use the UB channel. So UB channel in itself has a particular frequency. So based on that particular frequency, we start the metronome, and as per the metronome, we keep on using this particular bamboo moxa therapy, also called as Manaka therapy, right? So basically, it covers bigger areas. It is used to cover bigger areas for treatment. Hip, hip could be one area. If low back pain is not lumbar, so lumbar, thoracic, so bigger areas. Okay. Another conjugation therapy, I don't know, I have heard so many people also, so many of my patients, so many of my students ask me that, a lot of people do cupping therapy alone. Maybe it can be done, I have no idea. But as per my knowledge, as per my learning of acupuncture under the guidance of my Chinese professor, cupping is always used in conjugation to acupuncture, never used alone as per acupuncture therapy. So, conditions wherein there is a lot of stagnation. Now, the English meaning of stagnation could be different, but how acupuncture takes stagnation is like, so acupuncture, as I told you, works on energy. It's energy science. So there are acupuncture channels which run from the top of the head to the bottom of the toe, right? Now along these acupuncture channels there is flow of energy, right? And we say that there is disease in these channels when this energy stops flowing, or say there is like a speed breaker in between and the energy stops flowing. So we said that the energy has stagnated in a particular area. Now wherever the energy is not reaching, right, so those tissues, we say, they are not receiving any energy, right, so they are not able to function in their proper way. So when we use cupping therapy, we try and remove these local stagnations so that energy can flow properly. Now, the cupping therapy can be local and it can be distal. By local, as you can see, for this patient with low back pain, we are using cupping therapy locally for his low back pain in the hips, low back. But we can also, there are also specific points in acupuncture which are distal. Like pain is in the back, but we use, say, a point on the back of the knee for doing cupping, right? Also, cupping can be of two types. Usually, it's dry and wet cupping. The one that we show you here, this is dry cupping, right? Wet cupping is usually wherein one or two drops of blood are removed from the point and then the cup is introduced. Again, as I said initially, has to be a adjuvant therapy. Okay, coming to pen laser. All lasers that we use at our setup, they are all latest up to date new market lasers. They are all soft lasers, okay, cold lasers and superficial lasers, right? This is important to know about our laser, and they are cold lasers, right? None of these are warm lasers. So as you can see, this is a pen sort of laser in the form of a pen, and it is handheld. So these lasers, they have a particular frequency, right? It could be a, so this is the one that you are seeing is the one with continuous frequency, the one that we are using, right? So it gives a continuous sort of wave, that helps. And for acupuncture, we always use the lasers at acupuncture points, always, right? We do not use any trigger points, we do not use any muscle motor points. We always use acupuncture points. These lasers are done at acupuncture points, right? uh, at my setup, I usually try and combine the the acupuncture session with a laser session if the need be, right? So you can see that we are doing the laser at every point individually, right? Depending, like suppose I'll be showing in the next video that suppose if I want to cover a bigger area, like for example for a moxa, as I told you, so we want to cover a small area and bigger area. For small area we can use rice moxa, we can use roll moxa, right? But for bigger area, we need to use something called as a bamboo moxa or the manaka, all right? Similarly, the thing with laser, if you want to cover a bigger area, so for a smaller area you can use something called as a pen laser. But for a bigger area, we have developed this is an in-house development, you know and this is called as a helmet laser. This is like a innovative tool which is done so that it can cover a bigger area, because sometimes you have the, say, sometimes it's the entire piriformis which is in spasm. Okay, and this, as you can see, this is pulsating. So this is the pulsating frequency, this is discontinuous frequency, pulsating. Correct? Okay. Then we come to another therapy we use at our setup. It's called gua sha therapy. So it's basically we use a gua sha oil along with a jade stone, and it is basically a scraping therapy, right? So it helps us in two ways. It is therapeutic, that helps in treatment, also in diagnosis. So when we use this therapy, we get certain areas which are absolutely, you can say, absolutely purple, dark purple, blue. So it indicates those are the areas where there is a lot of stagnation happening, right? So that is, the gua sha therapy. So helps in treatment as well as helps in diagnosis, you know. And usually when we do a gua sha therapy, we try and let that area relax. We usually don't try and needle that area, so we try and let that area heal. And sometimes after gua sha therapy, you might have, say, a bit of soreness in that area. You can just use a bit of icing or a cold therapy, and usually it subsides. It is a self healing, subsides on its own. Okay, this is another type of moxa therapy. It's called a box moxa that we use. Again, as I told you, so this type of moxa, as you can see, there are a lot of fumes, right? So again, this is moxa wool, which I've put inside a moxa box, and I've burned the moxa wool. You can see the fumes coming out, right? So this again covers a much bigger area. So again, depending on what is the location of the pain, what is the area of pain, what is the duration of pain. Sometimes you would want, maybe a roll moxa or a rice moxa is not doing the job. So you have to think out of the box. Think that, okay, let's go for a box moxa, because the patient might be getting some relief, but not full relief. So then we use something called as a box moxa. Yeah. For this, you have to also be careful. When we are using, you have to have exhaust. We have exhaust in, so we have about 20 treating rooms at our clinic, and we have exhaust in all the rooms, so that the fumes do not cause hindrance to any other patient. And yes, otherwise, the box moxa therapy is a very safe therapy. Yes. Okay, this is one other treatment therapy at our setup called as Accutron machine, the Accutron treatment. It basically has pads with it, and it uses micro currents and micro frequencies for treatment, similar to the TENS treatment. So you can see these pads which are attached to the IFT therapy, as we call it. These pads, they are all attached to the acupuncture points. We only used acupuncture points for this, right? And as I said, the basis is use of micro and milli currents, which are there for treatment. And this is a treatment modality which does not use needles. So it is a needleless treatment modality. For patients who are apprehensive of needles, we can use this. Maybe for children, if they do not accept this thing. For very old patients, they might not, their skin might be very thin. There might be just a lot of bone there, so we can use this therapy, right? For rehab, a lot of patients come for rehab. We use it for rehabilitation therapy. So Accutron treatment is very effective. Yes. So a needleless form of treatment, which is very important, and it has very good effect on the muscle tone. We can manipulate the muscle tone very well using the Accutron treatment. Yes. Yes. Okay, so I think we are done with the modalities that we use at our clinic, especially for treating low back pain patients. And I hope you like this particular session. And I tried and provide and kept this lecture series as short as possible. And if you have any questions and all, you can put it in the chat, in the comment box, and I'll try and answer them. And see you later with another lecture, something which is, say, more specific, say one of the conditions, say about sciatica or something. And we'll talk about that later on. Thank you.